Hi, my name is Dr. Jared Thornton with Thornton Family Chiropractic. I want to take a quick minute and make a video about Medicare and Medicaid and talk a little bit about why some services are covered and some services are not covered under those two entities. Medicare and Medicaid, they break their services down by covered services and non-covered services. Okay, then we'll talk a little bit more about those. Covered services are further broken down by payable and non-payable. Okay, so the only covered services that Medicare and Medicaid cover for chiropractic care are spinal adjustments. So that means anything outside of the spine, a shoulder, hip, knee, ankle, foot, elbow, wrist, hand, are not covered, and those would fall under your non-covered services. Now, covered services, which are spinal adjustments, they are broken down into two additional categories, either payable or non-payable services. Now, payable services means that they met a criteria that they have set aside as saying that it meets medical necessity. That means that we can document that you have functional losses due to your condition, and that by treating through chiropractic care, we believe that your condition will improve. And if we can do that, then it meets medical necessity criteria, and we can treat that area, and Medicare or Medicaid will cover the cost for that service. Non-payable services, such as adjustments outside of the spine, as we mentioned earlier, physical therapy, therapeutic exercises, electrical stimulation, ultrasound, x-rays, laboratory work, blood work, supplies like back braces or ankle braces, those type of things are not covered by either of those entities. And you're expected, if you come in and you're treated and those services are performed, you're expected to pay out of pocket for those expenses. Now, the other thing that both Medicare and Medicaid do that become frustrating for patients is they require an examination to determine whether or not your condition meets medical necessity. Without performing an examination, they can say that your case does not meet medical necessity criteria, and they can actually deny payment for those services. So we are required to perform an examination. You as the patient are required to pay for the examination before we can actually begin treating you. Now, we can talk about whether or not I agree or disagree, whether or not this is a good thing or a bad thing. But these are the rules of Medicare and Medicaid. Because we are a Medicare and a Medicaid provider, we have to follow their rules. We are contracted to provide those services through them for you as the patient. And so unfortunately, our hands are tied. The only way to change those rules is to get the laws changed. And so if you want to let your congressmen and your senators know that you're unhappy about that, feel free to give them a call. The more people who call them and let them know, the more likely they are to change those laws. If you have any questions, please feel free to give us a call. We'd love to answer any questions that you have, and we hope to see you soon. Thank you.